Have you ever wondered what drives someone to constantly seek admiration and attention? Today, we're exploring Narcissistic Personality Disorder, or NPD, to understand its core characteristics and impact. Narcissistic Personality Disorder is a psychological condition marked by a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy for others. But what does this really mean? Individuals with NPD often have an inflated sense of their own importance. They believe they are superior to others and expect to be recognized as such, even without achievements that warrant it. This deep need for excessive attention and admiration can lead to behaviors that are self-centered and arrogant. They might dominate conversations, belittle others, or exaggerate their achievements. One of the most challenging aspects of NPD is the difficulty in forming healthy, reciprocal relationships. Their lack of empathy makes it hard for them to understand or care about the feelings and needs of others. This often results in strained relationships as their self-centered attitudes and behaviors push others away. Narcissistic personality disorder is characterized by grandiosity, a constant need for admiration, and a lack of empathy. These traits can lead to significant challenges in personal and social relationships. Understanding NPD is the first step in recognizing and addressing its impact. We're exploring the key characteristics of Narcissistic Personality Disorder, or NPD. Understanding these traits can help us recognize and better comprehend this complex condition. First and foremost, let's talk about grandiosity. This is a hallmark feature of NPD. Individuals with this disorder often have an exaggerated sense of self-importance. They genuinely believe they are superior, unique, or special compared to others. This grandiosity isn't just about feeling good about oneself. It's an inflated self-view that can lead to unrealistic expectations and demands from others. Another aspect of grandiosity is the presence of fantasies of unlimited success. People with NPD may be preoccupied with thoughts of power, brilliance, beauty, or ideal love. These fantasies can dominate their thoughts and influence their behavior. It's important to note that these characteristics can significantly impact relationships and daily functioning. Recognizing these traits is the first step in understanding and addressing narcissistic personality disorder. Grandiosity in NPD includes an exaggerated sense of self-importance and persistent fantasies of unlimited success. By being aware of these traits, we can better understand and support those affected by this disorder. Have you ever met someone who constantly seeks praise and admiration? Today, we're exploring the psychology behind the need for admiration and attention-seeking behavior. The need for admiration is a common trait that can significantly impact a person's behavior and relationships. Let's understand what this means and why it happens. First, let's talk about the constant need for praise. Individuals with this trait often require excessive admiration and validation from others to maintain their self-esteem. Without this external validation, they may feel insecure or unworthy. This leads to attention-seeking behavior. People who crave admiration will often go to great lengths to be noticed and praised. This can include anything from posting frequently on social media to exaggerating their achievements. But why do some people have such a strong need for admiration? It often stems from deeper psychological issues such as low self-esteem or past experiences where they felt undervalued. By seeking constant praise, they try to fill an emotional void. Understanding this need for admiration can help us empathize with those who exhibit these behaviors. It's important to recognize that their actions are often a way to cope with underlying insecurities. The need for admiration involves a constant craving for praise and attention-seeking behavior. By understanding the root causes, we can better support those who struggle with these feelings. We're exploring an important topic: the lack of empathy often seen in individuals with narcissistic personality disorder, or NPD. Understanding this can help us manage relationships and interactions more effectively. First, let's talk about the inability to recognize others' needs. People with NPD frequently struggle to understand or care about the feelings and needs of those around them. This isn't just a minor oversight, it's a fundamental aspect of their personality. Imagine trying to share your feelings with someone, only to be met with indifference or a lack of understanding. This can be very frustrating and hurtful. For individuals with NPD, this lack of empathy is a significant barrier to forming genuine, caring relationships. Next, let's discuss how this lack of empathy can lead to exploiting others. Individuals with NPD may take advantage of people to achieve their own goals, often without any regard for the impact on those individuals. This exploitation can manifest in various ways, such as manipulating someone for personal gain, disregarding others' boundaries, or using charm to deceive. The core issue here is the absence of empathy, which makes it difficult for them to see the harm they cause. The lack of empathy in individuals with narcissistic personality disorder can lead to an inability to recognize others' needs and a tendency to exploit people. By understanding these behaviors, we can better protect ourselves and foster healthier interactions. Have you ever encountered someone who constantly acts superior and belittles others? Today, we're exploring the topic of arrogance and superiority and how these attitudes can impact our interactions and relationships. First, let's talk about condemning attitudes. People who exhibit arrogance often display haughty behaviors. They may act as if they are above others, dismissing different opinions and perspectives without consideration. This kind of behavior can create a toxic environment, making it difficult for open and respectful communication to take place. It can lead to feelings of resentment and frustration among those who are on the receiving end. Next, let's discuss the act of belittling others. Arrogant individuals often devalue or belittle those they perceive as inferior. This can manifest in various ways, such as making condescending remarks, undermining others' achievements, or outright mocking them. Such behavior not only harms the self-esteem of the targeted individuals, but also damages the overall morale of a group or team. It creates an atmosphere of negativity and discourages collaboration and mutual respect. Understanding these behaviors is crucial because it helps us recognize and address them, whether we encounter them in others or, more importantly, in ourselves. By fostering a culture of humility and respect, we can build healthier, more supportive environments. Arrogance and superiority manifest through condemning attitudes and the belittling of others. Recognizing these behaviors is the first step towards creating a more positive and inclusive atmosphere. Let's strive to treat everyone with the respect and dignity they deserve. Do you ever feel like someone in your life expects special treatment or has unreasonable demands? Today, we're exploring the concept of entitlement and how it can affect relationships and interactions. Entitlement is when someone believes they deserve special treatment or privileges without earning them. This mindset can lead to frustration or anger when their expectations aren't met. People with a sense of entitlement often expect others to comply with their wishes automatically. They might become upset if things don't go their way, believing that they are owed certain favors or advantages. Unreasonable expectations are a hallmark of entitlement. These individuals might expect favorable treatment in various situations, whether it's at work, in social settings, or even within their families. It's important to recognize entitlement because it can strain relationships and create an unhealthy dynamic. Understanding this behavior can help us manage our interactions more effectively. Entitlement involves expecting special treatment and having unreasonable expectations of others. By being aware of these traits, we can better manage our relationships and foster a more balanced and respectful environment. Thank you for watching. Remember, understanding entitlement is the first step to healthier interactions. Stay tuned for more insights on improving your relationships. We're exploring the interpersonal difficulties faced by individuals with Narcissistic Personality Disorder, or NPD. Our focus will be on two key aspects: fragile self-esteem and envy. First, let's talk about fragile self-esteem. Despite often appearing arrogant or overly confident, people with NPD usually have a very fragile sense of self-worth. This means they are extremely sensitive to criticism or any form of defeat. Even a minor setback can feel like a major blow to their self-esteem. Imagine someone who seems to have it all together on the outside, but inside they're constantly battling feelings of inadequacy. This fragile self-esteem can make it difficult for them to maintain healthy relationships, as they may react defensively or aggressively to perceived slights. Next, let's explore the concept of envy. Individuals with NPD may often feel envious of others. They might believe that others have something they lack, whether it's success, admiration, or even happiness. This envy can lead to feelings of resentment and a constant need to outdo others. On the flip side, they might also believe that others are envious of them. This belief can further inflate their sense of self-importance and create a barrier to genuine connections with others. They may interpret others' actions through a lens of envy, which can distort their perceptions and interactions. Fragile self-esteem and envy are significant interpersonal difficulties for those with narcissistic personality disorder. Understanding these aspects can help us better manage our interactions with individuals who have NPD and foster more compassionate and effective communication. We're exploring the complex world of manipulative and controlling behaviors. Our goal is to help you recognize these behaviors and understand their impact on relationships. First, let's talk about manipulating relationships. Individuals who exhibit manipulative behaviors often do so to maintain their self-image or achieve their own goals. This can involve subtle tactics like guilt-tripping, playing the victim, or even more overt actions like lying and deceit. Manipulating relationships can be very damaging. It undermines trust and can leave the manipulated person feeling confused, hurt, and powerless. It's important to recognize these signs early on to protect yourself and maintain healthy boundaries. Next, let's discuss exploitative behaviors. This is when someone uses others for personal gain without any concern for the consequences. They might take advantage of someone's kindness, resources, or even their emotions to get what they want. Exploitative behaviors are often driven by a lack of empathy and a focus on self-interest. The person being exploited may feel used and devalued, which can lead to long-term emotional and psychological harm. Understanding these behaviors is crucial for maintaining healthy relationships. If you recognize these patterns in someone you know, it's important to set boundaries and seek support if needed. Manipulative and controlling behaviors can severely impact relationships. By being aware of these tactics and understanding their effects, you can better protect yourself and foster healthier interactions. Have you ever wondered what causes narcissistic personality disorder, or NPD? Let's explore the factors that may contribute to its development. While the exact cause of NPD remains unknown, research suggests it's likely a combination of genetic, environmental, and psychological factors. Childhood experiences play a significant role. For instance, excessive pampering or extreme criticism during formative years can contribute to the development of NPD. It's important to understand that no single factor is responsible. Instead, it's the interplay between our genes, our environment, and our psychological makeup that shapes who we become. The development of narcissistic personality disorder is complex, involving a mix of genetic, environmental, and psychological influences. Understanding these factors can help us better comprehend this condition. Have you ever wondered how narcissistic personality disorder, or NPD, is diagnosed? Let's explore the process mental health professionals use to identify this condition. NPD is diagnosed by a mental health professional through a thorough psychological evaluation. This isn't just a quick chat, it's a detailed assessment that looks at various aspects of a person's behavior and mental state. The diagnosis is typically made if an individual exhibits a pervasive pattern of narcissistic characteristics. These can include an inflated sense of self-importance, a deep need for excessive attention and admiration, and a lack of empathy for others. But it's not just about ticking off a checklist. The professional will also consider how these traits significantly impair the individual's functioning in various aspects of life, such as work, relationships, and social interactions. Diagnosing NPD involves a comprehensive psychological evaluation by a trained mental health professional. They look for a consistent pattern of narcissistic traits that disrupt the person's daily life. Understanding the diagnostic process is crucial for recognizing and addressing NPD. Treating narcissistic personality disorder, or NPD, can be challenging. Individuals with NPD often don't recognize their need for help. But there's hope. Therapy can be effective, especially certain types like cognitive behavioral therapy, or CBT, and psychodynamic therapy. CBT focuses on identifying and changing negative thought patterns and behaviors. It helps individuals develop healthier ways of thinking and interacting with others. Psychodynamic therapy, on the other hand, explores the unconscious mind. It aims to uncover deep-seated emotions and past experiences that influence current behavior. The goals of treatment often include improving self-awareness, developing healthier relationships, and fostering a more realistic self-image. Through consistent therapy, individuals with NPD can learn to understand their condition better and make meaningful changes in their lives. While treating NPD is challenging, effective therapies like CBT and psychodynamic therapy offer hope. The key is improving self-awareness, relationships, and self-image. With the right support, positive change is possible. We're exploring two essential aspects of personal growth: understanding our behaviors and improving our relationships. First, let's talk about developing insight. Understanding our own behaviors and recognizing how they impact others is crucial. This self-awareness helps us identify patterns and triggers in our actions. One effective way to gain this insight is through self-reflection. Take time each day to think about your interactions. Ask yourself questions like, why did I react that way? Or how did my actions affect those around me? Another powerful tool is seeking feedback from others. Honest feedback from friends, family, or colleagues can provide a different perspective and help you see things you might have missed. Now let's move on to improving relationships. Forming healthier, more reciprocal relationships is key to a fulfilling life. Start by practicing active listening. This means truly paying attention to what the other person is saying without planning your response while they're talking. Empathy is another crucial element. Try to understand things from the other person's perspective. This can help build stronger connections and reduce conflicts. Setting healthy boundaries is also important. It ensures that both parties in a relationship feel respected and valued. Communicate your needs clearly and be open to hearing the needs of others. Remember, building and maintaining healthy relationships takes time and effort. Be patient with yourself and others as you work on these skills. Developing insight into your behaviors and improving your relationships are vital steps for personal growth. Reflect on your actions, seek feedback, practice active listening, show empathy, and set healthy boundaries. By doing so, you'll create more meaningful and fulfilling connections in your life. Thank you for watching. Take these insights and start making positive changes today. We're exploring two essential aspects of personal growth: building empathy and managing self-esteem. These skills are crucial for fostering better relationships and enhancing our overall well-being. First, let's talk about empathy. Empathy is the ability to understand and share the feelings of others. It's about putting yourself in someone else's shoes and seeing things from their perspective. To build empathy, start by actively listening. Pay attention to what the other person is saying without interrupting. Show that you care by nodding and maintaining eye contact. This simple act can make a huge difference. Next, try to imagine how the other person feels. Ask yourself, how would I feel in their situation? This helps you connect with their emotions and respond more compassionately. Remember, empathy also involves recognizing that everyone has different experiences and backgrounds. Be open-minded and avoid making assumptions. This openness fosters deeper connections and mutual understanding. Now, let's shift to managing self-esteem. Self-esteem is how we perceive our own worth. It's important to have a healthy sense of self-esteem to face life's challenges confidently. One effective way to boost self-esteem is through positive self-talk. Replace negative thoughts with affirmations. For example, instead of thinking I can't do this, tell yourself I am capable and strong. Setting realistic goals and celebrating small achievements can also enhance self-esteem. Each step forward, no matter how small, is a victory worth acknowledging. Engaging in activities you enjoy and excel at can further build your self-worth. Whether it's a hobby, sport, or creative pursuit, doing what you love reinforces your sense of competence and value. Building empathy involves active listening, imagining others' feelings, and being open-minded. Managing self-esteem requires positive self-talk, setting achievable goals, and engaging in fulfilling activities. By focusing on these areas, we can create more meaningful connections and lead more fulfilling lives. Remember, empathy and self-esteem are journeys, not destinations. Keep practicing, and you'll see the positive impact on your life and relationships. Narcissistic personality disorder is a challenging mental health condition characterized by grandiosity, a need for admiration, and a lack of empathy. These traits often lead to significant interpersonal difficulties. Individuals with NPD often display an inflated sense of their own importance. They may exaggerate their achievements and expect to be recognized as superior, even without corresponding accomplishments. A constant need for admiration is another hallmark of NPD. People with this disorder often seek excessive attention and validation from others to bolster their self-esteem. One of the most challenging aspects of NPD is a lack of empathy. This means they may struggle to recognize or care about the feelings and needs of others, leading to strained relationships. These traits can result in significant interpersonal difficulties. Relationships with someone who has NPD can be tumultuous, marked by conflict and misunderstanding. Understanding these behaviors is crucial for recognizing NPD. However, addressing the disorder often requires professional help. Effective treatment typically involves a combination of therapy and support from mental health professionals. Narcissistic personality disorder is marked by grandiosity, a need for admiration and a lack of empathy, leading to interpersonal challenges. Recognizing these traits is the first step, but effective treatment requires professional intervention. Thank you for joining us today. Understanding NPD is the first step towards compassion and effective support.